The other day, I heard President Obama, and apparently this is part of the discussion in the Senate as well, that one of the ways that will be used to pay for these new benefits that are being discussed is to take money out of Medicare and Medicaid. Now, does this mean that providers are going to be paid less, thereby making providers tempted to take fewer Medicare or Medicaid patients? How does that work?
So this actually might be what Dr. Bates was just referring to in the changes he might like to see in how the federal government treats physicians. So reimbursement rates broadly with Medicare and Medicaid are a problem. We are slightly below the national average in Oregon than other states. Big states like Texas, Florida, California, they have, I actually heard a stat the other day that Charlie Rangel's district, in New York has actually the highest Medicare reimbursement rate. But it goes to a bigger question, not just about Medicare reimbursement, but what are we paying for, right? And how do we make the shift that Dr. Bates was talking about to focus more on the front end of care, primary care, prevention, chronic disease management, right, that front-end care, and then specialty care less. So it is part of the mix. The president was at the AMA, of all places, when he made that first remark about cutting reimbursement rates. There's great concern about that. That's not really probably the most optimal way to finance healthcare reform. There's other ways, I think, that we can pay for increasing coverage, but that's definitely something that's being talked about, especially in the Finance Committee, because they are the committee that has jurisdiction over Medicare and Medicaid. So it's definitely part of the discussion. I don't know how far that's really going to go. It was interesting that the AMA actually came out in support of the Senate Help Committee bill, which really didn't address the reimbursement rate.